All right, finding the right Medicare plan can be a mess, and time is running out. We're in the enrollment period. My next guest offers a service that cuts through the confusion and helps you find the right coverage, and their assistance doesn't cost you a dime. Justin White is the CEO of Senior Health Services. Okay, what I want to know is, these are my medications. Are they covered by Medicare or not?
Well, that's what we're going to talk about today.
Yeah, let's start with what Medicare is.
Okay, first I want to say, like, this thing right here is the only one of its kind that we know of. The prescription drug hourglass. My buddy Alan Hotchkiss from JSA, one of our partners, drove 1,000 miles and a whole bunch of hours to get it today here.
Yes, because we ran out of time.
There we go.
Ran out of time to enroll.
And speaking of that, that's what we're here to talk about. But let's talk about Medicare.
Yeah. Okay. So Medicare is for people. There are some people who are just about to come into the fold. Others are already in it. But Medicare is the purpose.
Exactly. And most of the people coming into Medicare age in at 65, okay? But there are ways to get in before 65 by virtue of disability. If you've been receiving Social Security disability for 24 months, you can qualify. And then for other certain conditions like end-stage renal disease and ALS, those are the folks that will qualify for Medicare. And it's government-subsidized health insurance, and it's a very popular program.
Yeah, absolutely, because we know when people retire, more limited income, and some of the biggest expenses you can have, obviously, would be medical care, right?
Absolutely.
All right, so Senior Health Services, I think there's a lot in the name, but tell us who you are.
Well, we are a full-service brokerage. We are local to the Houston area. We've got affiliate offices all over town. And what I mean by broker is we literally look at the whole landscape out there and can shop in an unbiased way to just find people things that service their needs given wherever they happen to be at that time when they're looking around. When there's a problem with a plan, we can go and look and find solutions for them. Yeah. And we get paid from other means. We don't charge anybody anything for that because we want to be a safe place where they can reach out to us and get help.
And an unbiased opinion as well.
Exactly.
All right, so I ran into somebody the other day who said, she was so confused, and she said, I thought you just signed up for Medicare and said, yes, I'll take it, right? No,
Exactly.
it doesn't work that way.
Exactly.
What's one of the biggest mistakes seniors make choosing a Medicare plan, whether it's for the first time or they've been in the program for a while?
Settling and settling for something that's less than their best. We run into people all the time. They'll say, "There's just something wrong with my plan," and we'll find out they've been in it for a long time. Yeah. And they don't get reviews on a sort of fairly regular basis. It doesn't have to be all the time, but when something starts going a little hinky, they need to talk to somebody and say, is there a solution to this that I can find? And that's what we do. So just settling and assuming that that's the best that they can do.
Or getting the same thing over and over again when your life has changed. Because especially on the back end of life, a lot of things change. You might need more medications, or you might have some physical ailments, right?
Exactly. And sometimes they don't reach out because they're nervous. I mean, we get these calls coming in, or they'll call an 800 number, and then their phone blows up and their email blows up and they don't know who to talk to. And that's an issue. So there's a little bit of fear there, for lack of a better term, of I don't want to call.
Also, we don't keep up with the changes, and there's some changes this year.
There are some changes. There are. And some will be good. I want to give credit where credit's due. There will be some good changes this year by virtue of the Inflation Reduction Act. It was passed in 22. Some of the changes, smaller ones, went in place in 23. Last year, they were small. Not many people really noticed them, but there's some big ones coming in January of this coming year, and some plans will be affected less than others, but the ones that are affected, people need to be aware so that they can plan if they're in a plan that's being affected or even eliminated entirely because of those law changes. It has to do with funding.
Yeah. All right. This is a quote from someone who is out there looking. It says, I've been researching online for the last 2 weeks. First of all, kudos to that person for researching, right? Because a lot of people don't do the research. But he says, and I am more confused now than when I started.
Absolutely.
And so came to you for services so we can leave the confusion to y'all. You will remove the confusion for us. And so what does it look like when we sit down and work with you?
First off, we try to decide whether there's a problem there. We don't fix things that aren't broken. So if somebody comes in, they just want to ask a question, that's their right. My gosh, just ask a question, and if there's a problem, then we'll deal with it. But if there's no problem, we're going to say there's nothing broken here, and explain to them why so that they can feel good about where they are and at least understand the circumstances. Usually there's an issue that we can work on.
Right. And knowing like what things that maybe you don't have to be paying for and other things that you might want to add.
Exactly. Or maybe there's a plan that's been upgraded that's over here, sometimes with the same company, and you've been in this plan for a really long time and are not aware of this other plan. We can say, hey, look over here.
Yeah.
And then it's just one little adjustment, and then all of a sudden we can help them with whatever's going wrong.
A little song just popped in my head. If there's a problem, yo, I'll solve it. Okay, was that right?
Exactly.
Thank you so much, because I think this is a time of life where a lot of people are confused, but also afraid, like you said, and you can help remove that. All right, to get free help with finding a Medicare plan that works for you, visit seniorhealthservices.com. That's seniorhealthservices.com. You can also give them a call at this number. It's 281-894-7540. Again, that's 281-894-7540.